Centuries have passed, and humanity has faced health challenges, with bowel cancer being no exception. From ancient times to the present day, the understanding of this devastating disease has undergone remarkable evolution. In the oldest medical records, we find vague mentions of symptoms that we now associate with bowel cancer. However, it was only in recent centuries that we truly began to understand the nature and severity of this condition. Welcome, this is the Life More channel. If you're not subscribed yet, make sure to subscribe to not miss any health-related videos. In today's video, we'll talk about the signs and symptoms of bowel cancer and the impact of the disease on the patient's life. Awareness and early detection of bowel cancer play crucial roles in the fight against this devastating disease. By increasing awareness of risk factors, symptoms, and prevention methods, we can help prevent future cases and diagnose the disease in more treatable stages. Early detection is key, as bowel cancer can develop silently without causing obvious symptoms in the early stages. When diagnosed early, the chances of successful treatment and cure are significantly higher. Screening tests, such as colonoscopies and fecal exams, are essential to identify precancerous lesions or early-stage cancers. Therefore, awareness of bowel cancer symptoms, along with regular screening tests, can save lives. What is bowel cancer? Bowel cancer, also known as colorectal cancer, is a type of cancer that develops in the large intestine, colon, or rectum. It originates from abnormal cell growths in the inner lining of the colon or rectum, called polyps. Over time, these polyps can turn into cancer. Bowel cancer is one of the most common forms of cancer, affecting men and women of all ages, although it is more common in people over 50 years old. Common symptoms. 1. Persistent abdominal pain and discomfort. Persistent abdominal pain and discomfort are common symptoms of bowel cancer. These symptoms can vary in intensity and duration but usually persist over time and do not go away on their own. Abdominal pain can be described as cramping or diffuse discomfort in the abdominal region. In some cases, the pain may be accompanied by abdominal bloating, a feeling of fullness, or abdominal distension. It is important to note that persistent abdominal pain and discomfort can have various causes, not just bowel cancer. However, if these symptoms persist for an extended period, especially if accompanied by other symptoms such as rectal bleeding, changes in bowel habits, or unexplained weight loss, it is important to consult a doctor for evaluation and possible diagnostic tests, such as a colonoscopy, to investigate the underlying cause of the symptoms. Early diagnosis of bowel cancer is crucial for effective treatment and better outcomes. 2. Change in bowel habits. A change in bowel habits is another sign that may indicate the presence of bowel cancer. This can manifest in different ways, such as persistent diarrhea or unexplained constipation. People with bowel cancer may experience a change in the frequency of bowel movements or the consistency of stools. For example, there may be an increase in the frequency of bowel movements, especially if accompanied by loose or watery stools, or there may be difficulty in passing stools, resulting in hardened or pencil-shaped stools. These changes in bowel habits can be persistent and not respond to changes in diet or lifestyle. If you notice any significant change in your bowel habits, especially if it persists for several weeks, it is important to consult a doctor for evaluation. These symptoms can be caused by a variety of conditions, including bowel cancer, and it is essential to investigate properly for an accurate diagnosis and treatment. 3. Rectal bleeding or blood in stools. Presence of blood in stools is a concerning symptom that may indicate the presence of bowel cancer. This bleeding can manifest in various ways, such as blood in the stools after bowel movements, bright red blood on toilet paper, or bleeding that is visible in the toilet bowl. In some cases, the bleeding may be intermittent and not immediately noticeable. It is important to note any signs of rectal bleeding or blood in stools and report them to the doctor immediately for a thorough evaluation. While rectal bleeding can have various causes, including hemorrhoids and anorectal fissures, it can also be a symptom of bowel cancer. Therefore, do not ignore rectal bleeding and seek medical guidance as soon as possible. 4. Unexplained weakness or fatigue. This persistent feeling of tiredness and lack of energy can be caused by the presence of a tumor in the intestine, which can lead to loss of blood and essential nutrients such as iron. Additionally, bowel cancer can also cause anemia, which can contribute to feelings of weakness and fatigue. It is important to pay attention to your energy levels and disposition on a daily basis. If you experience persistent and unexplained fatigue, especially if accompanied by other symptoms such as rectal bleeding, changes in bowel habits, or abdominal pain, it is crucial to seek medical guidance for a comprehensive evaluation. Therefore, do not ignore these signs and symptoms and seek medical help as soon as possible. 5. Unexplained weight loss. Unexplained weight loss is a symptom that may be associated with bowel cancer. When a person loses weight without making changes to their diet or level of physical activity, it may be a sign that something is wrong in their body. In the case of bowel cancer, weight loss may occur due to various factors, including a decrease in appetite due to the presence of the tumor, difficulty in absorbing essential nutrients from food due to obstructions in the intestine, or even the presence of toxic substances released by the cancer itself. If you notice significant weight loss without an apparent reason, it is important to seek medical guidance to investigate the underlying cause. 6. Feeling of incomplete emptying after bowel movement. This persistent sensation of not fully emptying the bowel may be due to the presence of a tumor that is partially obstructing the intestinal tract, making it difficult for stools to pass properly. This sensation may be accompanied by a feeling of fullness or abdominal discomfort after bowel movement. It is important to pay attention to these signs and symptoms and seek medical guidance if you experience this sensation regularly, especially if it is accompanied by other symptoms such as rectal bleeding, changes in bowel habits, or unexplained weight loss. Do not hesitate to discuss any concerns with your doctor. Warning sign. These symptoms may indicate the presence of colorectal cancer or other serious conditions that require medical evaluation and accurate diagnosis. Additionally, if there is a family history of colorectal cancer or if you are over 50 years old, it is important to be especially vigilant about these signs and symptoms and seek regular preventive medical evaluation. Early diagnosis significantly increases the chances of successful treatment, so never ignore persistent or concerning symptoms and seek medical guidance as soon as possible. Risk factors. Risk factors for bowel cancer include a variety of elements, such as personal or family history of colorectal cancer, age over 50, history of intestinal polyps, inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, diet high in processed meats and saturated fats, low fiber intake, smoking, excessive alcohol consumption, obesity, sedentary lifestyle, and type 2 diabetes. Additionally, certain genetic conditions, such as familial colorectal cancer syndromes, can increase the risk of developing the disease. It is important to be aware of these risk factors and adopt healthy lifestyle habits, such as a balanced diet rich in fiber, regular physical exercise, limiting alcohol consumption, and not smoking, to reduce the risk of developing bowel cancer. Importance of early detection. Early detection of bowel cancer plays a crucial role in improving the chances of successful treatment and patient survival. When diagnosed in early stages, colorectal cancer is often treatable and even curable. Screening tests, such as colonoscopy, fecal occult blood test, and sigmoidoscopy, can identify polyps or cancers in early stages, allowing for early interventions to remove them or treat the condition before it progresses. By detecting and treating bowel cancer early, doctors can reduce the spread of the disease and significantly increase the chances of successful treatment. Therefore, it is essential for people to be aware of the importance of early detection and follow screening guidelines recommended by healthcare professionals, especially those with known risk factors for colorectal cancer. Awareness of the signs and symptoms of bowel cancer is crucial to ensure early diagnosis and effective treatment. Do not ignore warning signs, such as persistent abdominal pain, changes in bowel habits, rectal bleeding, unexplained fatigue, unintentional weight loss, and feeling of incomplete bowel emptying after evacuation. By recognizing these symptoms and understanding the associated risk factors, you can take proactive steps to protect your health. Always remember to follow recommended screening guidelines and consult a doctor if you have any concerns. With early detection, treatment of bowel cancer can be more effective, improving the chances of recovery and survival. Prioritize your health and pay attention to the signals your body may be sending. Thank you for watching and caring about your health. If you enjoyed this video and want more useful information about health, don't forget to subscribe to the channel and turn on notifications to receive our updates. Your support is crucial to us. Stay tuned, as we are always working to bring informative and valuable content in the future. Until next time.